Okay, finally, our last but not least, our final panelist, Dr. Dorsa Maryska, is a nephrologist who practices in the eastern part of LA County, and she's going to talk a little more about the dialysis ballot initiative. Thank you so much.
Thank you. I would like to thank you all for inviting me here to speak about this topic. I too wish that I didn't have to be here and that this proposition did not exist. So, for what it's worth. If I could summarize Proposition 8, I would start with the following. And this is largely taken from the voter information guide that is available to all of you registered voters who I'm sure you have poured through everything with a fine-tooth comb, and you know all about dialysis now, so I'm speaking to the choir. My summary would be that this proposition purports to limit charges that dialysis providers can charge to payers for dialysis services to 115% of costs for direct patient care and quality improvement, whatever that means. It requires rebates and penalties if charges exceed the limit of what is actually paid for those purposes. However, the rebates and penalties may only be provided to private insurers and must exclude rebates and penalties to government payers such as Medicare and Medi-Cal. It requires annual reporting to the state of costs, and this annual reporting is not currently required. It would be reported to the California Department of Public Health, which currently is not a function of the California Department of Public Health and would add a whole new requirement for that agency to keep track of expenses of dialysis centers. According to the Legislative Analyst's Office, the effect on state and local governments ranges from net positive tens of millions of dollars to net negative tens of millions of dollars, which sounds like a wide range to me. This will affect 588 dialysis centers and 80,000 patients in the state of California. The proposition lists the 115% cap of revenues to include costs of the following. Number 1, staff wages and benefits. Number 2, staff training. Number 3, drugs provided in the dialysis center. Number 4, medical supplies. Number 5, facilities. And number 6, electronic health information systems. The fiscal effects are unknown because the allowable costs are vaguely defined. One possible outcome is that the dialysis providers could increase the allowable costs that they are billing in the unit, in the dialysis center, So, in other words, they could increase their profits by increasing the cost of care. 115% of a larger number is a larger number. Another possible outcome is that they could reduce their managerial costs. And that would mean basically cutting staff that are there to administer the care provided in the dialysis center. Another possible outcome that is allowed by this proposition is annual court challenges to the law by the dialysis providers that would be supported by the United States and California Constitution, which prohibits the government from taking property from private businesses, including the value of that business. So every year, the dialysis companies could come to the state and say, you have illegally taken our property, and we're going to fight you in court. And if they win, then that would be effective for 1 year from the date of that decision. And they could go back the following year and do the same thing again. And another option if dialysis becomes less profitable in the state of California would be that they would scale back operations. That means fewer new dialysis centers for a growing California population and a growing population of dialysis patients. And it also would mean that existing dialysis centers may close if they become unprofitable. These unknown fiscal effects lead to unknown scenarios. So would this be good for the people of the state of California? That is entirely up in the air. One possible outcome would be that the government would save money on employee health care. So there are many government employees. I would say the state of California is the largest employer in the state. And perhaps those employees that are covered by private health insurance options the government would save money on those plans. Another possibility is that we could lose money on those plans if the allowable costs are allowed to increase, as is one possible outcome. One interesting aspect of this is that the Medi-Cal program contracts for some of its services with private payers, so exactly the same scenario could affect the Medi-Cal program, in that Medi-Cal could end up paying more for the patients that are insured by that program that are on dialysis. In terms of tax revenue for the state of California, perhaps tax collected by the dialysis companies, since they are businesses, perhaps tax revenue would be lower. However, income taxes could be higher if the dialysis centers choose to pay their employees more. The administrative impact is, again, as I mentioned, the Department of Public Health will be responsible for an entirely new purview of their work. I would just like to make a humanitarian argument also for the end of my discussion, since I'm not quite an academic physician. Who are dialysis patients in the state of California? People whose kidneys have failed. They require dialysis treatments 3 times a week to sustain their life. If they miss one dialysis treatment, their risk of mortality increases by 30%. These are largely people, or to a disproportionate proportion, people of color. African American and Hispanic patients are disproportionately affected by kidney disease, and they would be disproportionately affected by access to care. Also, people of lower socioeconomic status are disproportionately on dialysis. In fact, a study done by Dr. Suzanne Nicholas, my old lab mentor here at UCLA, in 2015 reviewed that and showed that there was up to a 300% increase in the risk of African Americans over Caucasian people to be on dialysis at some point in their lifetimes. Dialysis patients, in my personal experience, are people who want to work and they want to have options to go to their clinic for treatment close to home. And this proposition, I feel, would hurt them significantly. It does not account for a large proportion of the expenditures that are required by dialysis patients, dialysis centers. And in fact, one study by the Berkeley Research Group indicated that only 69% of costs currently incurred by dialysis centers would be allowable under this provision. 83% of dialysis centers in this state would operate at a loss. And clearly, this would result in closed clinics and patients heading to the hospital emergency room for care. In summary, I believe this is a flawed proposition, and I am against it, and I welcome your questions and comments. Thank you.